Good morning. Thank you for taking the time.
No problem at all.
I really appreciate you offering your expertise today. It'll be a very interesting discussion. So
Yes, look forward to that. Thank you for giving me this opportunity.
certainly. So if you wouldn't mind um, telling the viewers what your name and where you live and what your background is, I think today it's going to be informative for people to understand the historical background Ayurvedic and how you got to where you are in terms of your training.
It's, that's going to be quite a long answer, I guess.
Well,
Uh,
we could always do a portion, and if we need to enhance
no,
it down the road,
let's start and see where it takes us.
that'd be great.
My name is Dr. Gaurav Desai, and I am based out of Goa in India, which is a beautiful part of the world. Um, I am an associate professor at the Goa University at the Gomantak Ayurved Mahavidyalaya and Research Center, which is a college offering Ayurveda training for students. I've been teaching there for the last 12 years now. And I also run two clinics in Goa, one in north of Goa, the other one in south of Goa. And they are purely Ayurveda clinics where we do our best to help our patients using the principles of Ayurveda in helping them with various issues that they face in their lives. Um, Practice is what really interests me because that is one area where I can make direct impact on people's lives, and that's gives me an immense sense of satisfaction, and I say this with all humility that I am very grateful that patients or any other people who need help give me this opportunity to try and make a difference in their lives. The other aspect where I teach that keeps me on my toes because students, as you know, can come up with all sorts of questions. They keep you on your toes. You have to be on the ball all the time. No slacking. So that helps in keeping me on the long and the straight. And so that's another enriching part of my life. So though you asked me how I got into Ayurveda, though the beginning of my journey into Ayurveda was not as smooth, it almost reached a point where I wanted to not continue. I wanted to quit and do something else because of the fact that it is quite challenging for a young student to understand certain concepts of Ayurveda. But I was lucky and I was blessed to be surrounded by people and mentors who guided me really uh, skillfully and made sure that I remained into the course. I remember I had almost decided that I will not continue. I wanted to change my vocation, but I have this a guru who I revere, who was my teacher, and I continue to be associated with him even to this day. Who said to me, "Give it one shot. You take the first exam, and if you do not do well at that exam, you're free to do what you want to do. But he said, give it one sincere try and see where it takes you." And those words were almost prophetic. And here I am talking about Ayurveda to you. So that's what the reason I bring up this is because a lot of young students or who are looking to learn Ayurveda initially have a lot of thoughts that they build about the science in their heads, but when they actually start the training is when the reality hits them, and it can hit quite hard. That it is not all as simple and straightforward as it seems. There is a lot of science, there's a lot of philosophy behind it. It's not just the science, it's a wonderful marriage of science and philosophy put together. And one needs to make a little bit of extra effort to be able to understand that. So I always say to my students, if somebody like me could do it, I'm sure you all are much better. So from that point of view, always uh, make it a point to narrate this story where the beginnings were not smooth sailing at all.
But it does seem that there is a deep connection between the philosophy, the spiritual aspects, and the approach to the body that is very unfamiliar with Westerners. I mean, there's more in the West now of, they consider it mind body, but I think from what I gather, this is a much more global viewpoint of the whole person, the type of person. And so maybe you could talk a little bit about um, what you do when you see a patient. Is there as in all practices, there are gathering of information and then clinical evaluation and then making decisions. Could you talk a little bit about how you approach a patient that comes into your clinic for some form of illness? I mean, our website is more about cancer, but the observations and examination is going to be the same, I assume, for every patient.
Yes. Look, when I first interact with a patient, uh, and I'll give you a little background about when is it that people approach Ayurveda. The usual story is if there is something that they face with regards to their health, the first option would be to go to a practitioner of modern medicine or allopathy, the conventional science, and from there they may be directed towards a specialist and go through a few more tests. If that doesn't help, then they'll look for somebody else, someplace else. Again, more tests, more specialists, more opinions. And at the end of it all, if they still cannot find answers, that is when they think, okay, look, now where can I go now? And that's when they think of all the other so-called alternative systems of medicine, which includes Ayurveda. So by the time people generally, and of course things are changing where people have slowly started to look at Ayurveda as their first option, but I'm giving you a general story. So by the time they approach an Ayurveda physician, they already have like a big, thick bunch of reports and papers and tests and everything else that they come with. And the first thing, and it's so sort of into people, drilled into people's mind, is they come with a diagnosis straight, and then they want you to go through the file. But I always say to them, look, I'm not correcting the reports. I'm trying to help the person. So before I even look at the file, I would like to speak to the person. I would like to see the person. That's the first thing. So you connect with the person, and then you try and understand the condition. You're not even, it's not like you look at a few figures on the paper and then try and remedy those. It's not that. So the first thing that's required is the connect with that person, trying to understand uh, about his demeanor, trying to understand about his constitution, trying to understand about his state of physical health, the state of mental health, and also trying to connect into the emotional side of things. Also, try and understand if at all there is any spiritual background, or if there is no understanding of spirituality, how is it that you can uh, drill that into or make that connect with that person? So this is the general approach that we as Ayurveda physicians are trained to taking.
Well, it's very common to hear that once you have a diagnosis, people seem to just take you as a label and you have this disease, and so there's a specific way of approaching it. And for what you're saying, that isn't working for the people that you're seeing or even initially. So you've kind of started over at the beginning. I thought it was very interesting. Maybe you could comment. You commented about demeanor and constitution. Tell me a little bit about what you look for in the demeanor of a patient. I think it's really not something that most practitioners of any sort are trained to be able to get into and focus on and understand. So you obviously have a specific manner that you start off with. Maybe you could talk a little about that.
Yes, look, the first thing to understand is every person is different. That's the basic understanding that no two people, they may be born on the same date, in the same place, at the same time. They may be twins for all you know, but yet each twin has his or her own personality. They have their own preferences, they have their own choices, they have their own way of doing certain things. And here we are talking about twins who have, who come from the same seeds. So when you have so much of a difference, even in twins, you can well imagine how, how different each person that you encounter will be. So when I speak of the demeanor, what I am looking to assess is what is the state of mind of that person. One has to understand that here is a person who has not found answers to his or her questions or problems or challenges, be it mental, be it physical. Usually it's physical, it starts with physical. So, is he or she frustrated? Is he or she angry? Is he or she in a state of almost giving up, losing hope altogether? Or there are some who are very tough. Now, even when they project a sense of toughness, is it only a facade that they are putting out? Or is it for real? Because each type of makeup of an individual will require a different approach of
Mhm,
dealing with it.
mhm.
If you have somebody who is almost given up, then you will have to work harder in trying to make the person understand that, look, this is not the end of the world. You may not, I may not, and I'm not saying that one has to give the person false hopes. Yes, you can be very realistic, but you can always say that, look, just because there is a goalkeeper, you don't, stop trying to score goals. So it's like that. So the approach there is different. Where somebody who is very tough, very feisty, says, "I can face this. I'll not buckle down. I will continue with my routine. I'll continue with my way of life." Sometimes you have to rein such people in, trying to tell them that, look, because of what you're facing, you better, change your diet, better you change your lifestyle. You cannot go on this way because that will mean that you will not be able to last long. So, to be able to decide the approach, you to be able to decide the general sense of direction that you need to take, it is extremely important that you understand the individual that you are dealing with.
Well, it sounds like you're looking at the attitudes they're bringing to your treatment, and your job is to help. I don't know whether you change it, but help them understand where they're coming from and where they can be going, which I think is so important. It's kind of finding that middle road. It's not if you're too much of one end or too little at another, it's not going to work for anyone. So when you do this part of your evaluation, how long do you normally spend? I mean, it obviously varies from individual to individual, but it sounds like it's the first key item that you have to focus on in order to really decide how you're going to direct your care.
Yes. So normally, for a new patient, it would require at least 45 minutes, and it can stretch to double that time also. But I would put, if I have to put a number on it, I would say it should be about 45 minutes to 60 minutes to be able to first establish that connect. And mind you, this connect does not or may not even happen in the first instance. Somebody may not be open to sharing their actual thoughts or their feelings or their exact state of mind. So that depends on your skill as a practitioner, how you can and how quickly can you form that connect and develop enough trust,
Exactly.
that sense of trust, which is very very important, and that has a lot to do with the practitioner himself also, because many a times the focus is so much on the patient that one tends to neglect what the approach that a doctor has to have, and what is the sort of projection that a doctor has when he or she, and it could be very, and over the years I've learned that patients are observing you very minutely about the choice of words, about your appearance, about the confidence that you exude, and all these things. So it becomes extremely important that you also make sure that you are in a prime state of health. When I say health, I'm using the Ayurveda definition of health, which means not just absence of disease, but it's physical, mental, emotional, spiritual well-being. So it's important for the doctor also to be in the prime of health to be able to then make a difference in somebody else's life.
So you have to be walking the walk in order to,
Absolutely,
and,
absolutely,
and also,
absolutely.
and the other aspect that you alluded to about your mentor, I think that when you're studying in health, having the experience of someone else to show you the nuance, oftentimes you'll observe someone, and when you talk to someone with great experience, like when you're teaching your students, they miss certain points that are key to them being pulled into how to do this correctly and approach it correctly. So I think it's really wonderful that you can work in both students and in clinics to have that perspective of what's going on. I think that's great. So you also talked about the Constitution. I think that's what most Westerners are aware of, is at least vaguely about what the constitutional aspects, but there are so many areas that here you are, you've barely scratched the surface of how is this person going to take in what I'm giving them and be able to want to do this and make it a partnership. So we're doing this together and it's not, here's your prescription, I'll see you in 2 weeks.
Look, for successful treatments, there are, it's like four wheels of a car. And if one wheel is not working, the car is not going anywhere. So if you consider your treatment as the car and the four wheels are, one obviously is the physician who has to be, and then the condition or the functioning of each of these wheels has to be top notch. Otherwise, there's going to be imbalance and the treatment will not succeed. So the first wheel is the physician. The second is the the paramedical staff. So you have all the support staff that work or that have a role to play in the treatment. So it could be the nurses, it could be the technicians, it could be the pharmacists, it could be the therapists, and all of these. The third wheel is the medications or the treatment modalities, the therapy, what is actually prescribed to the patient. It could also be the diet part of it. So all those medications or medicaments or dietary factors, all of those have to be working, or all of those have to be of top-notch quality. And the fourth wheel is the patient. Because if each of these three other wheels are working at their optimum, but if the patient is not cooperative, if the patient is not open to accepting the work put in by all these other factors, you're not going to go anywhere. So the word that you use, that it is a partnership, it cannot be like an outsourcing where I will not do anything for my health. I will expect the doctor to take charge and do everything that's needed. It's not how it works. But unfortunately, uh, the way the medical setup is such that it almost is a given that you walk in there and all you have to do is narrate your symptoms. You will be prescribed medications, be given a prescription, and once you start popping the pills, everything will magically set itself all right. That's the way things are drilled in people's head. But one's health is one's own responsibility. And I always tell my patients that look, if we have to be able to help or make a difference, we have to be able to help each other. Because without that, without us cooperating, without us being on the same page, it will be very difficult to make any progress.
Well, and it sounds like that if everyone is individual, each of those steps or each of those wheels need to be individualized so that they fit exactly into a good movement of the car to be able to
Yes,
run smoothly.
yes. So that's what each wheel. Now, if I have to elaborate further,
Sure.
every part has their own qualities. So, for example, one of the qualities of a physician is obviously that he or she has to have good knowledge about the science. Not only good knowledge, but also the understanding about the applications of that knowledge. Because it's one thing to learn the whole book by heart, to know it verbatim, but if you don't know how to apply it, it's of no use.
Can you talk a little about the text, about the books that you study? I mean, I think that's very important. I think that in America, a lot of people just think, oh, I have this certain constitutional pattern, and if I just change my diet, I'll be doing great. But there is a method to how this is approached. Can you, and are the textbooks really ancient? I assume they come from many millennia of experiential work by other
Yes,
physicians.
yes, yes. Look, if I go back to the absolute basics, Ayurveda has, or there are references of Ayurveda in the Vedas, which are one of the first, which are the earliest written scriptures available. And then, if I have to talk about books that are directly related to Ayurveda, there are the three major uh, treatises. One is the Charaka Samhita, the next one is the Sushruta Samhita, and then there is the Ashtang Hriday and Ashtang Sagata. So these three form the basis from which most of or almost every Ayurveda thought or principle originates from. And these treatises were recorded after years and years and years of research, refinement, change, and research again. So there's test, then refinement of the results, then retesting, and then finally, when everything was completely authenticated, was it recorded in the form of the treatise. And that is the evidence for that is that those principles are true even till this day. They haven't changed in spite of a difference of almost 5,000 years. The principles that were laid down, yes, the application of the principles may have changed. We may use better equipment, we may use better clinical setup, we may use better way of delivery of things, but the basic principles have not changed at all. So if they were not, a lot of times people ask, oh, is it scientific? Is there any evidence? Is there any testing? How can you say that this statement is true? The very fact that it has stood the test of time and has not changed over thousands and thousands of years is the biggest evidence that it has been recorded only after thorough testing.
Well, that I think is very important. I mean, people want to look at studies where everybody in a group is given a certain treatment, and in integrative care, it becomes essentially an individual property. But if you have the correct principles to apply to each individual, then you can come up with a determination of what you want to do. So I think that's important for people to understand that this is not a new philosophy. It's not being, each doctor is deciding on their own. Everyone that practices tries to follow certain principles, because then you can transfer that information with each patient and know that you're following the correct path.
So I may just come in here about people talk of the difference where on one hand you're saying Ayurveda is very individualized, and then you're still trying to say that no, we'll try and standardize Ayurveda. So now, though these two statements appear like antagonists of each other, but what one needs to understand is yes, it is individualized. But when you talk about standardization, you're talking about standardization of the not of the actual implementation of the process, but you're talking about the standardization of the principles, where every doctor understands the principle in a standardized manner. That way, he then has a liberty to apply the principle in a manner which he deems fit at that moment in time for the patient. So, for example, if there is a change or if there is an imbalance in the vata of a person. Now, people in the West are also quite familiar because of the constitutions that you mentioned. People are aware of what vata, pitta, and kapha are. Vata, pitta, kapha are. So, if there is an imbalance in vata, a physician will use properties, use uh, drugs, or may use medications, will use diet, will use other therapies, which have qualities which are opposite to vata, thereby it will be balanced again. Now, the principle is that you have to use qualities which are opposite. So, similar will increase and use of opposites will decrease. So, if there is an increase in the vata, you will use properties which are dissimilar to vata to try and balance it out, and vice versa. Now, how do I do that? Depends on so many factors. Depends on the individual, depends on the age, depends on the genetic constitution, depends on the geographical location, depends on the diet, depends on the lifestyle, and so many other factors. So, how I apply those principles to an individual is is variable. But the fact that I have to use opposite to reduce and similar to increase remains the same.
And yet it sounds like both are trying to bring a homeostasis, a balance to the
Yes,
system. It's really, the principle is balance, and how you get to the
absolutely.
balance is what you're discussing here, similar or dissimilar. It certainly
Yes,
sounds like you have to decide what the patient needs, or you can totally make the situation worse.
yes. Yes. So that's where the understanding of the underlying cause comes in.
Oh,
Because without that, if you keep pumping medication on one side and the patient indulges in what is leading to that condition on the other side, it's not going to change. I'll give you an example where there was a 3.5-year-old boy who came with a skin condition. It was like an eczema, eczematous patches around his elbows. And the usual story, as I mentioned some time back, they went to the conventional doctors, they tried all sorts of things, applications, and It only gave them temporary relief where till the time the steroid cream was applied, everything was okay. The moment the cream stopped, it flared up again. And then they approached us. What we decided to look at, like we always do, is also what sort of diet did the child indulge in. Where we found certain dietary combinations which were not ideal, which are known to lead to a condition that presented itself.
Mm.
So we took a twofold approach. One, we prescribed medications, we prescribed herbs to try and reduce the itch, to reduce the dryness, and to ease the discomfort. And we also made sure that the mother and the parents were made aware of what should be avoided from the diet. And within 2 weeks, everything disappeared, and it's been 8 months now that the boy is still free from the eczema, and the medications have stopped.
Well, it's
So
a,
the medications, sorry, the
oh,
medications played their part in trying to remedy what was immediately seen, but the diet made sure that the thing did not repeat itself.
absolutely. It's very interesting how how a lot of approaches are. It's really about let's treat the symptoms, but they forget that there's like you were saying, the cause. The underlying root problem has to be addressed, or you'll just treat symptoms for forever. And again,
Yes,
I think that's what happens to in the of the patients that bring their large files. They know what's wrong, and they're doing what they're supposed to do, and it's not changing it because they can't go off their medication.
yes. It's like trying to fill a bucket, with holes, trying to fill it up with water. Unless you plug the holes, you'll never get the bucket full.
So do you see a large variety of conditions, or do you tend to specialize more towards an older group? It sounds like you see all different age groups and levels of problems.
Yes, I haven't limited it to a particular uh, an ailment or a particular system. It varies, but generally speaking, we do work more in conditions related to the skin, in the musculoskeletal system, also related to the gastrointestinal system, and uh, slowly cancers also, where look, I wouldn't go as far and say that, oh, we treat cancer, but what we definitely have a role in is in improving the quality of life, maintaining the quality of life, helping in quicker recovery, and also minimizing the chances of recurrence.
Absolutely. I think it sounds like also you see patients that come to you that have been treated. You must see a lot of people that have been devastated by the Western treatments that they've had. So even though they have all the things you're talking about, it sounds like you have to rebuild a lot of people with cancer before you can even start to know what to do to create a balance in their bodies. Is that something you see a lot?
Yes, yes, and probably it'll make it easier with another example. I'll give an example of a 32-year-old lady who first approached, and she had been a patient of mine before for a different condition, and her family visit me often whenever they need help with their health issues. So she first approached with some rectal bleeding, which initially for a 32-year-old, the usual suspects would be, is it to do with hemorrhoids, or is it to do with a fissure or something like that? We tried to take that approach and help her. It did give her some relief, but there wasn't a complete relief as such. That's when we thought we'll put her through some tests. We asked for a colonoscopy, and oh, I'll take a little detour where a lot of people think that because they're going to an Ayurveda physician, they will not have to go through various tests or scans or things like that. But I'm a strong believer in if there are methods available for you to try and understand the condition. Uh, Ayurveda has never said that one should not use or take whatever help that is available. So yeah, I do recommend all these tests as and when required, as and when necessary. So that's another little misconception that a lot of people have when it comes to Ayurveda. So coming back to the story, she was sent for tests, and then there was a growth that was discovered, and eventually things happened, and it was diagnosed as cancer of the rectum, which is very, very unusual for that age group and for also India. It's more common in the West and in the older age group. So even her oncologists and her oncosurgeons were surprised that at 32 she faced something like that. So now the only option was surgery because there was growth that had to be taken off. So we worked together uh, with the oncologist and the oncosurgeons, as in not directly, but through the patient. They were aware that we are also helping her, and we were also aware of what was happening from their end. So we worked together, and what then this were her words that in the ward she was the healthiest looking, which is saying a lot. You know what? It's almost hell that cancer patients go through as a part of their treatment.
Yes.
So sometimes they say they don't know what is more fearful: is it the disease or the treatment? It's that bad. So, in spite of such a situation, the very fact that she could somehow cope better than the others in the ward who were having similar treatments was a testament to the fact that, look, if an integrated approach is taken, the recovery is much better, the quality of life is maintained, and post recovery also. Now she is declared. It's been a year, and she's been declared as cancer free, and she's leading a life which is as close to normal with a few dietary restrictions, and we are monitoring her. So this is how if this both the sciences work together, it's ultimately the patient that benefits. And as doctors, I think that should be the priority.
And do you find that Western trained physicians are willing to have a dialogue with you and are willing to allow their patients to get Ayurvedic treatment along with their care?
Not all of them are,
Mhm.
and a lot of it has to do with a lot of myths and misconceptions about Ayurveda. So I don't blame them. I think it's the onus is on us to spread the word and to make people understand that, look, this is what we are saying, this is our point of view, and we don't want to digress. We don't want to step on your area and try and intervene there. That is not our aim. That is not what we intend to do. But let us work as a team, keeping the patient's priority at the topmost of our minds, and have that approach. So if there is a dialogue and one can make them understand, then they are very much open to working together.
Well, I think that's true, and it sounds like the advice that you're giving your patients is often very safe to be doing, making dietary changes and doing mind-body things, and the things that you're offering are really supportive things to help their own bodies. It's not invasive per se. Would you agree that that's the case?
Yes, and use of certain herbs as medications also. It's not only dietary changes, it's not only lifestyle changes, but it's also a few interventions, but non-invasive interventions, which augment the treatments that are already going on, and which, as you rightly pointed out, work on healing the body. That is like really going through a tough period.
And also, I assume you discussed the three textbooks. I assume there's also a great deal of information on herbal therapies that you used, on when to use them and how to use them and what they're available to be helpful with, I assume.
Yeah, so it's like there's a whole materia medica of various herbs with description about their qualities, when to use them, how to use them, in what doses to use them, what are the dietary restrictions to be followed if you're using any of them, what are the indications, contraindications, drug interactions. So it's quite detailed, and after which one can select the right herbs and prescribe it. Now, when it comes to consuming them, it can be in their absolute basic form, then it could be in the dry powdered form, but with advancements in technology, they could be encapsulated, they could be converted to tablets. Then there are the water soluble extractive in the form of decoctions, the fat soluble extractive, which is in the form of medicated oils and ghee. So there's like a whole uh, array of options available as to how one can use the different herbs.
And are the herbs primarily plant-based?
Yes, there are also some metal and mineral origin,
Mhm.
uh, like metals and minerals, let's put it like that, that are a part of the therapeutics. And again, this is another common myth that there is a lot of heavy metals and heavy metal toxicity related to Ayurveda. Some of it is true, but I'll tell you why or how one can be affected negatively by it. The biggest issue that I believe is the myth that Ayurveda is safe and it has no side effects, which is an absolutely untrue statement. Because of this, what happens is there is an indiscriminate use of medications
Mhm.
without proper understanding. The only understanding is this is Ayurvedic, so it has to be safe. So there is injudicious, improper use of metals, minerals, medication, herbs, the works. So any Ayurveda therapeutic agents, if they are used without supervision and injudiciously, they can cause harm. But that is also true for every allopathy molecule as well.
Yes,
So there is no difference.
absolutely. I think it's pretty
So
common for people to believe they can, I don't want to use the term, but they study at the University of Google. And it says, if
yes,
you have this problem, you can take this and it'll help you. Why not take the advice of someone that's actually studied it? And that's, I think, the most important, one of the more important messages is that there's a depth of training, there's a depth of principles, there's a millennia of information. Take advantage of it in terms of what you need to do, in terms of where you are. Well, I'm
yes,
wondering,
absolutely.
pardon?
I agree. Yes.
Oh, I think those are very important aspects. So I'm looking at some of the notes I have, and there's a number of goals and there's a number of plans in terms of how to proceed with how you evaluate a patient. I wonder if we should consider picking this up in a second interview down the road so you can explain more. I think people get a pretty good understanding right now of the sophistication of what you're offering. And I'd like to, if you're available, pursue that further so they can understand how you direct your care so that they really have a much better idea. Is that something you'd be willing to do?
Yes, of course. Yes, that would
Okay,
be very interesting.
I think it would be.
Thank you. As I said right at the beginning, I'm very grateful for the opportunity. And yes, thanks for allowing me to share my views about the science that I've been blessed to be a part of. And yes, look forward to connecting with you in the future. Thank you.
Thank you very much.